Ottinger. I work with the program committee from the Village of Tacoma Park. And as you all know, the Village of Tacoma Park is the sponsor of this session. We are going to ask everybody to please mute themselves during the presentation. And a little bit of housekeeping first, and then I'll introduce our speakers, our folks from the folks in the know who are going to share information with us, okay? First of all, we would like to ask that you do mute. I think everybody has done that. Thank you so much. During the presentation, our presenter, Rafael Espinosa, I'll introduce him in a minute, is asking that we hold questions, put them in the chat as we go along. And he's going to try to go through the presentation first, because often getting through the presentation answers many of the potential questions. So put your questions in the chat. And his colleague, Mary, who I'm going to also introduce in just a minute, is going to manage the chat, monitor the chat, and collect questions. And we'll deal with those at the end. I think that's pretty much, let me check my notes here. Yep, that's pretty much all of the housekeeping we need to do. Is there anybody who's not familiar with chat? If so, if you just put your cursor at the bottom of your screen, you'll see about halfway across the bottom a little thing that says chat with a little balloon. And if you click on chat, you can open a little space at the far right bottom of your screen, and you can type in a message where it says type message here. And then just hit enter, and the message will come to the folks who need to see it. Okay. So let me introduce our speakers, and our presenter is Rafael Espinosa. Rafael, I've got you, let's see, I've got you on mute. Can you unmute yourself, Rafael? Okay, both of these folks are from the Montgomery County State Health Insurance Assistance Program, which works out of the Jewish Council for the Aging, JCA. Rafael Espinosa is the director. He's going to be our presenter, and his colleague, Mary Baldion, did I say it right? Baldion, I think I said it right, is the program administrator, and she's going to be monitoring the chat and helping with questions. Okay, and I'm going to be quiet now and let Rafael take over and share his information with us.
Thank you, Paula. Welcome, everybody. Let me share my screen. Give me 1 second.
Oh, Rafael, I'm sorry to interrupt. One thing I forgot to mention is we are going to record this session, everybody. So it will be available in some other formats later on through the village and or through the Tacoma Park City government media functions. So if you don't want to be on screen, I don't know, Robin, are the folks who are not muted visually, are they going to appear in the recording? Or just the slide presentation, the PowerPoint?
I think everybody, it will be included in the recording. That's my understanding.
Okay, so if you don't want to appear on screen, then mute your video. I don't know what the right word is for that, but mute your video, whatever the right way to term that is, whatever is the right term for that. All right, I promise I'm not going to interrupt again, Rafael. You're on. I'm quiet.
It's Paula. I guess you're referring to block your video. That's what everybody should do if they don't want to appear. Okay. Welcome, everybody. Thank you, Paula, again. This is Rafael Espinosa, Director of the Montgomery County State Health Insurance Assistance Program. And today we're going to have this webinar addressed to the Medicare Open Enrollment, which is coming up. But before we move to the actual open enrollment, I wanted to make a refresh about Medicare. So everybody who is enrolled in Medicare have two options. Option one is when you use your Medicare your insurance. It's also known as original Medicare. And that includes your Part A, your Part B, obviously your prescription drug plan, and your Medigap or Medicare supplement. And option two is when you enroll in a Medicare Advantage plan or Part C, which include Part A and Part B coverage. And many of these plans already come with a prescription drug in their plan. Additional to the same Medicare coverage, you get some other benefits that Medicare doesn't cover. Your Medicare Part D is your prescription drug plan. That's what everybody needs to enroll if you decided to go as original Medicare. Now, if you choose to join a prescription drug, a Medicare Advantage plan, then a prescription drug plan is included already on the Medicare Advantage plan. In order to be part of that Medicare Advantage plan, you must have a Medicare Part A and Part B to enroll in a Medicare Advantage. Now, if you already have a Medicare Advantage plan, you can switch from one Medicare Advantage plan to another Medicare Advantage plan if you decided to do so. Now, keep in mind that by joining a Medicare Advantage plan, that doesn't mean you stop paying your Medicare Part B premium. You have to keep paying your Part B premium no matter what. And the main reason is because in order to be able to join a Medicare Advantage plan, you have to have Part A and Part B. If you stop paying your Part B premium, more likely you're going to be disenrolled from Medicare. And therefore, by being disenrolled from Medicare, you're going to be disenrolled from your Medicare Advantage plan. So it's a consequence of it. Now, under Medicare Advantage plan, you have different plans offered here in Montgomery County. They bring, a prescription drug coverage, and they also provide you extra benefits like vision, hearing, dental, and routine physical exams. You pay, obviously, a small premium. Right now, the lowest premium is, I believe, $25. And the highest is $351 for a PPO. And all of these plans have annual out-of-pocket limits. Based on the plan that you pick, the out-of-pocket limit can increase or decrease. Now, these are the questions that you need to ask if you are interested in joining a Medicare Advantage plan. These are the questions that you need to ask yourself if you travel a lot, and visiting relative or family members in another state, and you stay there for quite some time, and you need to see doctors. If you join one of these Medicare Advantage plans that are HMO, unfortunately, you will not be able to see any doctors outside your network, and your network is located here. If you are, for instance, in Florida, unfortunately, you cannot be able to use your Medicare Advantage plan to see a doctor unless you have an emergency and you're in an emergency room in a hospital. That will be different. But for regular doctor's visits, you have to be in your network area. Also, you need to ask you question yourself how many times you see or you need to see your doctors, what kind of specialists you need. You need to find out if the Medicare Advantage that you have in mind, see if they have this kind of specialists, if they are close by, or you need to travel some distance in order to see them. So those are another questions that you need to ask. If the Medicare Advantage provide you all the services that you are looking for. Now, if you are not considering in join a Medigap or Medicare supplement, or you consider in drop the Medigap or Medicare supplement because become a little bit too expensive for you, then a Medicare Advantage will be a good option for you, because being as original Medicare without a Medicare supplement or Medigap, it put you in a position that you may get some outstanding medical bills. Since you no longer have a Medicare supplement or Medigap, then remember the Part B only covers 80% and 20% is your responsibility. When you have your Medigap or your Medicare supplement, that 20% gets taken care by these plans. But if you drop them and you just stay as original Medicare without your supplement, then that 20% you have to come out of your pocket. If you don't have, or you have facing some financial difficulties, then your option will be, to avoid outstanding medical bill, your option will be Medicare Advantage plans. What you can do during the open enrollment period? You can switch your prescription drug plans if you have one right now. You can join a Medicare Advantage plan if you have an original Medicare. Now, this open enrollment period is every year from October 15, which is coming up in 2 weeks from now, through December 7. During that period, you pick a plan that is more cost effective for you for the following year. This is the only time that you actually can switch and pick another prescription drug plan for the next year. You cannot do this in another open enrollment or another period of time, because this is exclusively for that purpose. Now, if some people are getting a sort of benefits like low income subsidy or extra help, they are allowed to switch prescription drug plans at different times. At least, I think they can do it additional to the open enrollment. They can do it 3 times during a year. Once you switch and you identify what a plan is good for you for the next year, you enroll with them. You can do it online or you can do it by calling them. And this plan became effective January 1st of the following year. Now, what you need to do before you make this switch or these decisions, you have to review your current health and drug plans, because these plans change every year and usually change not in your benefit. Increase premiums, coverage get change, and then your prescription drugs or your medications are no longer covered, or you need to pay more for them, your copays increase. So you have to review what you have right now and make sure that your plan has been notified you of potential changes that will affect you for the following year. Usually they start sending correspondence in the mid-August. You have not received anything from your prescription drug plan in regards to changes for the next year, I encourage you to contact them and ask them if there are changes coming up, because if there are and you are not informed and you don't do the right switch at the time, you may end paying some extra money that you were not counting on it. Even if you are happy with your current plan, you may need to explore other options just to see if you may save some money or get extra benefits. Again, if you are original Medicare and you have your prescription drug plan, and then you have your Medigap or Medicare supplement, and you are seeing that these costs are increasing every year, and you wanted to have a more steady cost, then you may thinking and switching to Medicare Advantage. And by switching to a Medicare Advantage, not only you no longer have to pay a high premium for your Medicare or Medicare supplement or Medigap, but also you reduce that premium to just the small amount that you may pay for your Medicare Advantage plan. Also, you will eliminate your standalone prescription drug plan premium because you no longer need it. If you join a Medicare Advantage plan, that Medicare Advantage plan comes with a prescription drug coverage. So you save some money right there. Again, it's only a matter of you to explore and see if this is something that you would like to do, okay? So you can do it. Just take advantage of it, you know. We coming up with very low premiums in Medicare Advantage plans and also in prescription drug plans. You know, currently, for instance, the cheapest plan is $7.10, and that may not change much. Probably next year we're going to have something similar to it as a lower prescription drug plan premium. So that stay, you know, steady, has been steady and going down a little bit every year. So maybe hopefully next year will be no difference. Now, a Medicare Advantage plans are available to you through you. Probably everybody already has received their Medicare 2020-22 Medicare and you book. At the end of the book, you will see the list of Medicare Advantage plans available to you in Montgomery County. Now, in the item where you say location, and look for a MO as a you know, as Montgomery County or MC. And then you will identify the plan that you're looking at actually is being sold in Montgomery County. Unfortunately, all these plans that are listed in that book and not necessarily are available to you here in our county. So you need to look at it very carefully right there. Now, in order to find a prescription drug plan suitable for you, cost effective, you need to do it in two ways. You can do it with us. We provide you this, we call it prescription drug analysis, free of charge. We don't charge. Or you can do it yourself by going to, you know, Medicare.gov and either create an account or just go over without creating an account and do the Medicare Plan Finder. And by doing that, you can find a prescription drug plan for next year based on the information that you place in there, the medications that you take. They will tell you which plans premiums are lower for you and how your medication is covered. So you can identify those plans and you can see if this is something that you would like to do in terms of how much money you're saving, basically compare the plans, how much deductible you're going to pay. You know, if you don't want to pay deductibles, then you know, you look at it for plans that don't have any deductibles or very low deductible, like $100, for instance. So those are you know, the items that you need to look at it when you do the Medicare.gov plan finder. But the most important part will be is how much you're going to spend through the year, the total drug and premium cost. That's why you need to look at it if you are doing this yourself. And that will include your premium and your medication cost. And this is a very good tool, but if you are not feel comfortable in doing it yourself, again, we can help you, you know, as a cheap program. We provide these free services to you. You can contact us and we can help you get this through and find you a better plan for next year. The special enrollment periods during this, you know, open enrollment is to change your Part C or Medicare Advantage plan. You know, if you are a original Medicare and you want to pick a Medicare Advantage plan, and also to switch your prescription drug plans. This is the open enrollment for that you are waiting in this coming up October 15. Now, some people who has been in WellCare, for instance, they are consolidating their plans. And you probably, if you are a WellCare member and you have a prescription drug with them, and they probably send you a letter where they are telling you that the plan that you are having right now, that costs, I believe, $26, is being increased to 64 or 67, something like that. And it's a very substantial increase. So that doesn't mean that you need to stay with that plan. Obviously, you do this, prescription drug analysis with us, and we will find you maybe under the same insurance, under WellCare, a cheaper plan. You know, you don't have to stay with the same plan. Even if they still cover your medication, your premium increase almost $40. So even if they cover your medication, you may find also with WellCare a cheaper plan that covers your medication as well. You know, so keep in mind that these special enrollment periods are specifically, as you can read in your screen, for certain situations, and like a life change situations. So if that is your case, if you moving from one place to another, and when I say place, I better be more specific. If you move even from county to county, if you move from Montgomery County to Frederick County, you having a special enrollment because we don't share the same plans, especially Medicare Advantage plans. You know, and then you will have the chance just because you move to switch your Medicare Advantage plan. And that can happen in any part of the year. Or if you are receiving, some sort of coverage and you lost that coverage. Let's say the insurance company is no longer providing coverage in this area. If you do lose your plans or your coverage because of that, also you have a chance to enroll in another insurance company with the same plan. And then the other way to to use this special enrollment is if your plan changes, is contract with Medicare. So Medicare will allow you to switch plans under those circumstances because it's beyond your control. And these changes are not what Medicare was actually predicting. Those are the situations, special situations that you can change plans, Medicare Advantage or prescription drug plans. And these are limited. Usually they give you 60 to 63 days to do the change once it happens, okay? So it's not that you have open period of time to do this. It's very limited time. Now, make sure that you review your Medicare summary notice. Fraud is potential out there. It's very common fraud committed to Medicare. People use other people's Medicare information in order to obtain services. Some providers abuse their Medicare beneficiaries by giving them treatments that they don't need it. or more than what they needed. So keep alert, keep your eye open, helping Medicare saving money. It will help you at the end because they can increase their Medicare coverage. Right now, for instance, Congress is talking about increasing Medicare coverage or expanded it, I better say, to dental coverage, vision, and hearing. If that gets, approved by Congress, if that pass, then Medicare will be a very good federal health insurance for us because it will take care of most of our needs. Now, as any other insurance, nothing covers 100%. So always we need to come out with some money to pay out some, outstanding medical bills. So Medicare is not the exception, but it will expand their coverage, hopefully in the near future. Now you can start doing, you search, decide where you can stay or in original Medicare or start looking at Medicare Advantage plans. Make sure that if you decided to switch, make sure that the plan that you are joining covers everything that you need, okay? If you need more questions or you need to ask questions, you need to contact us either by phone, by email, or if you need more information about different other plans or situations that may you have, you can go to our website. Now, let me tell you how you can receive the prescription drug analysis assistance from us. You can go to our website, which is in your screen, www.medicareabcd.org, and you can complete there our electronic form in order for us to do your prescription drug analysis. We can do that. Or you can call this 301-255-4250, which is our main number, and you can request a form if you are not comfortable and using the computer or the internet, and you want to do paper, you can request a paper form calling that number 301-255-4250. And or if you prefer, also you can go back to our website and download the form. If you don't want to fill it out the electronic form, you can download the form from our website and you can mail it to us or email it. If you decided to email it, you can email it. Our email address is there, ship@accessjca.org. Or you can mail it to us to our address. I don't think we have our address there, but I can give it to you. It is 12320 Park Lawn Drive. And this is in Rockville, Maryland, 20852. I will repeat, 12320 Park Lawn Drive, Rockville, Maryland, 20852, and you just put Montgomery County ship, and then we will get you form here and we will do the analysis. Now, all these processes will start in October 15. Beginning next week, our website will be updated with our 2020 electronic 2022 electronic form for next year, and also you will see there the new 2022 prescription drug analysis form placed in our website for you to download it. You can start going into our website to do that beginning next week. Don't go now because we are working with the updates. So just wait until Monday, Tuesday next week to jump into it and try to do this from our website. Okay, so you have different options. You can do it yourself by going to medicare.gov and do the plan finder, or you can do it through us. Now, we just focus it. I just want to make sure I'm clear about this. We just focus it in prescription drug plans. Okay, we don't address Medicare Advantage plans. So if you want to see another Medicare Advantage plan available to you for next year, then you have to do it through Medicare.gov, the plan finder. With us, we will do only the prescription drug plan analysis, no Medicare Advantage plans. Okay, I just want to make sure that you understand. So just to summarize, the open enrollment, the Medicare open enrollment is specifically to switch Medicare Advantage plan, to switch prescription drug plans, and to drop original Medicare and join a Medicare Advantage plan. Only for those purposes are the open enrollment. And if you wanted to do any of those, then this is the time to do it from October 15 through December 7. Now you may hear, and this is some people confused, there is another open enrollment coming up, and that is through the state marketplace. That's the Maryland Health Connection or the federal marketplace that you hear in the news that has been extended up to January 15. That is for people under 65 who get the Obamacare. Okay, that doesn't have anything to do with Medicare. I just want to make sure, don't get confused, because sometimes we misread the news and we say, oh, I have until January 15. No. That is for different purposes. Doesn't have anything to do with Medicare. So now, I hope this short webinar addresses more of you concerns. If not, I'm ready for questions.
Okay, Raphael, we have some questions. There are many ads on TV now as we approach open enrollment that claim you may be able to enroll in a Part C plan that returns money to your Social Security monthly payment. Is that true? And if so, how does it work?
Okay, I'm sorry, you break a little bit, and at the end, can you repeat the question, please?
There are many ads on TV now as we approach open enrollment that claim you may be able to enroll in a Part C plan that returns money to your Social Security monthly payment. Is that true? And if so, how does it work?
I never heard anything like that, that a Medicare Advantage will give you money back to your Social Security benefits. This is the first time I hear something like that. Probably sometimes, like I say at the end, people get confused in between the marketplace open enrollment, which is for people who are getting qualified health plans through the government, or Medicaid, and Medicare open enrollment. And unfortunately, it happened almost at the same time, and that confused people. Maybe they're referring to a qualified health plan that give you tax credit, and you pay very low premium or don't pay any premium at all. It's like a subsidized plans, but that's different. That doesn't have anything to do with Medicare. That may be the case. I'm not 100% sure, but I never heard anything related to Medicare Advantage plans that will return money to you back to Social Security. I don't know what to tell you about that, and I don't think that could be possible.
Okay. When can you switch Medigap plans?
Okay. Medigap don't have a open enrollment. Unfortunately, Medigap, the only time that you can call it open enrollment is when you enroll in Medicare Part A and Part B, and you have from that moment 6 months to pick your Medicare supplement or Medigap. And that 6 months period actually is called a guarantee issue rise. You can say that's the open enrollment, those 6 months. During those 6 months, you can pick one plan. If you don't like a month later, you can switch, as far you do it with the 6 months. After those 6 months are gone, you can actually switch to any Medicare supplement or Medigap at any time. The problem is that you're going to be underwriting. And by being underwriting, you premium probably based in the questions that you answer, mainly medical questions, obviously, plus your age, probably that premium will be very high. That doesn't mean you cannot switch, but if you decided to switch, probably it's going to be very costly.
I have a Medicare Advantage plan and go to an ER and the attending physician is not in the plan and I get a bill. Can I send that directly to Medicare and have them cover it minus my Medicare deductible?
If you are part of the Medicare Advantage plan, if you are in an emergency room and the doctor is not part of the network, obviously, your insurance is the one who needs to take care of it, not Medicare. In this case, you need to send that bill to your Medicare Advantage plan. They are the ones who need to take care of it.
If we switch plans, how quickly can we expect our records to be transferred to the new plan holder?
When you refer records, you're referring to all the year that how many times you have been using, and not clear about when records. You be more precise or specific about when I refer to records. Because we're talking about here Medicare Advantage plans. If you switch from one Medicare Advantage plan to another during this open enrollment, it will become effective January 1st. From that point, how long the new doctor that you pick is going to request your previous doctors from the previous plan records, that only depends in the communication right there. And it's not in a specific time how soon they're going to get it. If that's what you're referring, it's up to the to you all plan to provide information timely.
Does Medigap coverage include prescription drug coverage?
No, unfortunately, about 15 to 20 years ago, Medigap plans stopped providing coverage, or supplemental coverage to prescription drug plans. No, currently there is no Medigap or Medicare supplement that cover prescription drugs.
We have a new question. I have WellCare, which bought out my AARP, I believe. I don't remember seeing their letter that the cost is going up to $64 or $67. Are all their costs on their website?
And you should contact WellCare immediately if you have not received the letter. The reason why they are increasing it, is because they are consolidating their plans. Medicare requests that instead of having 8 plans offered to to the public to reduce it to 4 plans. So your plan maybe is one of those plans that maybe have not suffered any changes. I don't know. I don't know what plan do you have, but I'm referring to the most common plan that is about $24 that has been increased to 64 or 67. So if you have not received a letter, you should contact your member service immediately.
Can I switch from original Medicare to a Medicare Advantage plan during this open enrollment?
Yes, you can. Yes, you can. And as a matter of fact, this is the only time you can do it, coming from original Medicare.
Okay. I don't have any more questions. Oh, there, wait a minute. There's another one. You mentioned that there is a discussion of original Medicare expanding coverage to things like dental, vision, et cetera. Could you review that again? What is the potential coverage that they are discussing? And is there any expectation of when it might come up for vote?
It's hard to say. Remember, we're dealing with Congress here. They are more right now focusing more on the shutdown, the government shutdown, than actually anything else. But we actually expecting in the budget no later than in the beginning of next year, they should be announcing something in regards to that. The main coverage that they are discussing is dental. If we don't get the other two, it's fine, but dental is the one that maybe will be up front. They are actually adding the vision and hearing as well, because it's part of the non-coverage Medicare. But I think they focus more at this time in just the dental. Hopefully that will not be the only one. Hopefully the other two items as well. But it's hard to tell. It's hard to tell when or give you a time frame. I cannot do that because if I say something and it may not happen, so it's just to wait high and.
Okay, I don't have any other questions unless somebody from our audience has questions. So I guess this is last call for questions.
I see in my chat here in my screen 7. Those are the 7 questions that you just asked me.
Yes.
Okay. Anybody else? Again, let me just reinforce. If you want us to help you with your prescription drug analysis, please go to our website, to our www.medicareabcd.org, and you can complete the electronic form there, or you can download the paper form there, and you can either email it or you can mail it to us. Our email address is ship@accessjca.org. And our mail address is 12320 Park Lawn Drive, Rockville, Maryland 20852. Or you prefer to call us, and leave us your name and your address. We can and let us know that you would like to receive a prescription drop form. We will actually mail it to you just by calling us. Our number is right there. It's 301-255-4250.
Raphael, I've already put that in the chat for everybody.
Wonderful. That is great. Thanks. That was Paula. I didn't see you.
Yes, hi, I'm here. I was
Okay.
gonna jump in and say, would you please just one last time give everybody your contact information, and you were way ahead of me. Okay, so I guess we're done. This is a wonderful resource, SHIP. You have their contact information if you have further questions. I want to thank everybody so much. First of all, thank Mary and Raphael for doing this presentation for us. And I want to thank everybody who joined us on behalf of the Village of Tacoma Park. If you have information that you want about the village, please just go to Village of Tacoma Park on the internet for our website and learn more about who we are and what we do. Does anybody have any last comments before we clock out?
Paula, I see in the chat that it used to be 7, now it's 11. I don't know, those are 4 more questions.
Oh, let's check. Mary, why don't you take a quick look at the chat since you're managing that and just be sure we've got everything. I think some of the additional messages are your contact information that Mary put
and
in.
some people have said thank you.
Oh,
Oh,
okay.
right.
Oh, okay. All right. Great.
Okay.
And so this is it. And I really appreciate it for having me and Mary as your presenters. Keep in mind, October 15 is coming up, and you have it until December 7 to switch your prescription drug plan or join a Medicare Advantage plan or switch a Medicare Advantage plan for 2022. So if as Paula says, something come up later on, you have our contact information, give us a call, shoot us an email, and we will be more than happy to address your questions. So thank you, everybody, and have a wonderful rest of the day.
Thank you, everybody. Thank you, Robin, for handling our Zoom, and everybody stay well. Bye-bye.
Bye-bye.
Bye-bye.